I'm now going to turn to one of our popular sessions, which is our parent panel. So I'm going to introduce about 4 panelists tonight who are going to talk about their recent surrogacy journeys in a range of countries. We're going to, let me just get everyone on video. But we've got Lilac and Jeff are here, who've done surrogacy in Ukraine, I believe, with World Centre of Baby.
Yes.
Julian Parkinson is here, who's done surrogacy in Ukraine also. He's an Australian dad. And let's see, I've got Costa here as well. I'm trying to find where Costa's gone, who's done surrogacy in Ukraine. Sorry, in what am I saying? In Canada. And who am I missing? And Lika has done surrogacy in Georgia. Let me just get Lika on as well. Thank you, everybody, for sharing your stories today. You've all got a really diverse range of stories. And Costa's got his bubby here. Costa, what's your little one's name?
Her name's Pan, P-A-N. Like it means everything in Greek.
Oh, sweet, sweet. Julian, I know very well. He's based in Brisbane, and he has done some media over the months about his story, which was a very dramatic story, really, of getting him and his French wife into Ukraine during a COVID lockdown. It was hair-raising at best, getting there, and we thought for a while we weren't going to get Julian's wife into the country. Look, can I just, I might just start with you, Lilac. You guys are based in the USA, is that right?
Yes, correct.
We are. Okay, well, so what made you choose Ukraine as a country to engage in?
Well, frankly, the price is significantly cheaper than what it is here in the US. And the packages are a lot more affordable. They're pretty much all inclusive. And, you know, for us, traveling is really insignificant. You know, US citizens can pretty much get in anywhere. Yeah. And when we reached out to the US Embassy, they were very supportive of our efforts. And World Centre of Baby did a really good job of navigating everything once we got to Ukraine as well.
That's great. So when was your baby born?
July 3rd, in the midst of the pandemic as well.
Oh, wow, amazing. And tell me, were you doing egg donor surrogacy or your own egg surrogacy?
Right. So we actually did an egg donor here in the US, did the embryos in the US, the PGD testing and everything here. And then we did a round of an embryo transfer here with me. Yep. And we suffered a miscarriage, and then we decided to go the route of Ukraine. So we transferred 2 embryos out to Ukraine.
And
we have 1 son.
Well, wonderful, wonderful. And how did the shipping process go, shipping the embryos over? Was that difficult?
No, not at all. World Centre of Baby helped us coordinate the effort. They made a recommendation, and I don't know if there's a lot of different carriers that do this kind of work, but the carrier we used was very familiar with where the embryos were stored here in the US, as well as where the embryos went to in Ukraine. Right. So it was like very routine for them.
Sure. And you only shipped over 2 embryos. You only had 2 to work with.
Right.
Okay. And did the first one take? Is that correct?
No, the first one did not take. We ended up having the second one took.
Okay, that's a relief. Gosh, wow. And how did that pregnancy go? Was it a smooth pregnancy for your surrogate, or?
Pretty routine. We had a couple situations where our child was on the later side of the development. And we found that the Ukrainian doctors were very aggressive about doing the medical tests, and if anything looked in any way atypical or unusual, they immediately scheduled our surrogate for another round of testing within a week, sometimes 2 weeks, depending on what the issue was and needing the child to develop a little bit further, to get a little bit further along. Yeah. It was very reassuring.
Yeah, that's great. Julian, for you and Sophie, how did you do your surrogacy? Did you travel over there at the start and make embryos in Ukraine?
Yeah, we did. We went over in July last year. Yep. And went through the process. I think we ended up with around 10 embryos all up. 5 of those were of reasonable quality. So yeah, we decided we wanted to have a boy. So I think out of the 5, 2 were male. So
Okay, so yeah, that's a good point. So you are allowed to do gender testing in Ukraine, aren't you?
I'm basically part of the PGS. I think it is testing of the 5 chromosomes comes out with a gender result. So, and because that was part of what we were wanting anyway, it sort of worked both for both. So yeah, and yeah, we had one transfer and we got lucky straight away. So yeah.
Yeah, that's great. Lila, coming back to you, was it hard giving up the chance of using your own eggs?
Not at all. You know, for me, it was all about Jeff and I had decided we really wanted a child. And, you know, when it came down to it, I make a joke of it now. I say that I've outsourced my uterus and found a surrogate. You know, I have a donor egg, you know, and at the end of the day, I have a beautiful, healthy baby boy. So all in, I really can't complain about anything, you know, and one of the benefits for me is that, you know, not only do I have a healthy baby boy, which I probably wouldn't have had with my own eggs. So, you know, I have that reassurance.
Yeah. We had a bit of a nightmare getting Julian and his wife Sophie into Ukraine. What was it like for you, Lilac, in traveling over there for the birth? Was it difficult?
Yeah, when we traveled, we left on June 16th, you know, during the pandemic. So Lilac pretty much coordinated everything as far as travel arrangements and all that. So when we landed, we had to go through, you know, 2 weeks of, you know, quarantine in a hotel. So it was like, we got off the plane, we went through customs, they finally let us in with all of our documentation, why we were there. And cab drove us to a hotel, which to me was like, we didn't know where we were, but all we knew is we had to sit in a hotel room for 2 weeks and then take the COVID test. So that way we could get into the hospital for the birth. So, you know, it's kind of like Twilight Zone, it's just kind of surreal. But that was the protocol and we had to do it. And,
yeah, sure.
You know, we were going to do whatever we had to do.
So how long after the birth were you able to see your baby?
Within a couple hours.
Oh, okay, great. So you were able to get there 2 weeks early.
Yes, we were there 2 weeks early. We flew out on one of the first among the first few flights from the US to Ukraine once Ukraine reopened their borders. Because we weren't sure how long the borders were going to be opened. We wanted to be there earlier rather than potentially miss the birth. We got out of quarantine. We had a day of x-rays of our lungs and things like that were additional tests required by the maternity hospital Adonis. And then literally the next morning, we got a phone call from World Center Baby saying, head over to the hospital, the baby's coming. Right. And within a couple hours, we saw him.
That's great. What about you, Julian? Were you there in time for the birth?
Yeah, eventually we managed to get there. So yeah, we did the 2 weeks quarantine in an apartment in the city. And yeah, I think it was a couple of days later. Oh no, maybe 4 or 5 days later that Liam decided that he was going to come. And yeah, but we obviously weren't allowed into the hospital. But I think within about 45 minutes, we managed to see him, which was pretty exciting. We had to pull a few strings for that to happen, but Ukraine's the place where that, you know, you can make those sort of things happen if you've got the right people on board, I guess. So yeah. It was pretty disappointing. Sophie really and our surrogate really wanted to be together when he was born, but you know, we were happy with that. It was pretty amazing.
Yeah, sure. Costa, let's turn to your story now. What made you and your partner decide on Canada as a place to go to have a family?
Sam, thanks very much for the conference 2 years ago in Melbourne, which you just saw the result of. Really appreciate it. We listened to everyone openly. We knew nothing. We were so green. And as Canada began to speak and we went and spoke to people who had set up little stalls, we began to realize that the Canadian system, its altruistic legal setup, the fact that they also kind of had a service through Near Kieran that we met in your conference that was kind of like a guidance service. So it was lovely to, which he calls concierge.
Yep.
And so we knew nothing, and we just thought, okay, we're going to ask some questions of Nia, but we didn't get to speak to Nia properly. We spoke to him that night, so his eyes were hanging out of his head. Still came out to dinner and let us know an enormous amount. And we stepped in quietly, quickly, and were able to get eggs. We were able to go to Canada. We were able to create embryos, but on advice mostly. It was just how easy it was.
Yeah, great. So you're a gay couple. You needed a donor, and so you were able to engage with a donor agency in Canada, were you?
That's right. Yeah.
Yep. Okay. How was the process of selecting an egg donor? Can you walk us through how that works?
Yeah, sure. It was really easy, actually, and we were surprised at how easy it was.
Yep.
We were really well heard about what we were looking for and what we wanted. It was kind of unusual because we weren't looking for particular look. We were looking for a particular person. You know, we wanted empathy and we wanted other things that were important. So we're looking at that in the person's life. And we were pointed to a surrogacy agency that was able to really serve that. And within 2 days, we were able to find an egg donor.
Yep.
The egg donor, because we believe the child has a narrative that we need to make available to the egg donor in the start didn't want to be known. Mm-hmm. And we thought, oh, damn, we've lost her, and everything was delayed. But then the egg donor changed her mind based on the advice and discussion through. So it's not just like everyone just provides a service. It gets tailored for you as you go along.
Yeah, it's great. And how many embryos were you able to make in Canada?
We have 9 embryos, and we're down to a few.
Okay. And did you do what some gay couples do when you split the eggs between the two of you? Did you do it that way?
That's right. Yeah.
Great. Okay. So, do you think you'll go again? Do you think you'll have another go at some stage?
We have started to go again. We actually went in with the intention to go twice.
Yeah.
And we work with a place called Create, and Create had 2 live births.
And that's the IVF clinic, isn't it?
That's right. Sorry.
Yeah.
And we've started our second journey.
Yeah, great. And will that be with the same surrogate or a different surrogate?
No, unfortunately, our Pan's surrogate mum got very ill and has lost her uterus, but she's still a part of our family. And so we're working with another surrogate. And so we've noticed our family's opened up a lot. Mm-hmm. Yeah.
Can you tell us what it's like to engage in surrogacy at such a distance? Was it stressful not being able to be there during the pregnancy, or was it okay?
Oh, Sam, no, it wasn't okay. It was stressful. And the truth is it presses every button in you. It pushes your need to have grit and patience and empathy and everything. But we got through, and we got through with really good advice and phone calls from our lawyer, from, Babies Come True, which is near, from our surrogate herself, her mum. It's kind of lovely because as things happen, it binds you. You don't just become close. You have an upset, something happens, people help you through it, you help them through it, you develop your bond. Yeah, it's a process. Yeah, it worked for us in Canada. Yeah.
And tell me, how many embryo transfers did you require to have success that first time?
It was on the third.
Third go.
Yeah. Okay. Yeah, and each time it was, what I liked was each time it was assessed and it was discussed, and there was this collaborative decision. We weren't left out of it. We weren't kind of passengers on it. And that also deepened our relationship with Pan's surrogate mum, and therefore now have a stronger friendship.
Yeah, that's great. I mean, is it hard for your surrogate? Not when it doesn't work the first few times. Is it hard for both of you?
Oh yeah. Poor Stephanie. She ended up with bruised tummy from all the injections, and we were up late, calling each other, but we were all determined together. But it was really tough for her. There were times when she would just lose it. As in she was exhausted and was flat on her back and needed a week off. And that was a really valid kind of response to being pumped full of stuff to make sure that she was okay in the end. It wasn't just, hormones. It was making sure she was okay.
Yeah, yeah. Lika, you've been very patient here. You did surrogacy with Reparat in Georgia. Can you tell us what made you require surrogacy in the first place? What medical issue did you have?
I don't have any issue actually with anything. So with my health, me and my husband have identical gene, so that's why I can be pregnant, and we decided to do IVF procedure, but 3 cycle was unsuccessful, unfortunately. Yes. That's why we decided to do surrogacy. So I was in the United States when we decided to do this one, and we transfer our embryos. Like I had 3 frozen embryos, and then all stuff I did on a distance. So I was in the United States, and a Reparat all team that really helped me to do. And I have 5-year-old baby, healthy girl from the first try.
Okay, and that was 5 years ago.
Excuse me, one more time.
The birth was 5 years ago, is that right?
Well, first one was 5 years ago, yeah, and right now I'm on a second journey. So. Okay,
great. And you're also like living in the USA, are you?
Yes, I live in the United States, so
Okay.
11 years, yeah.
Okay, so did you want to have a relationship with your surrogate, or did you want to keep the surrogate at more of a distance?
No, I have all relationship, like by Skype, by WhatsApp, everything. So, and other stuff they're doing in a Reparat team. So, and actually all my family members, they're living in Georgia, so they're kind of helped me too. So I was really comfortable stay in the United States before my baby was delivered. So I went to Georgia 2 weeks before my baby was born, and I don't have any problem like with the birth certificate. She got dual citizenship, U.S. citizenship and Georgia citizenship. So I don't have any problem with all paperwork too.
Yeah, that's great. Lilac and Jeff, I know for U.S. citizens, it's quite quick to come home after surrogacy. How long did it take you to come home after the birth?
We were home. Sorry.
Yeah,
yes.
Lika, you go first.
I'm first. Okay. Actually, I stay in my home country like around 3 months, but I get all paperwork, I think, during 1 month, something like this. But I went back after 3 months. Okay.
And Lilac, what about you?
It took us a little bit over a month, but we found the Ministry of Health and the Ukrainian government, as well as the U.S. Embassy, incredibly supportive, very quick. The timelines we were given initially were a lot longer than what it ended up materializing into.
Yeah, yeah. Well, Julian, what was it for you guys to come home? How long after the birth?
I think it was around four weeks. I came back a little bit.
That's right. You came up a bit earlier. That's right.
Yeah, came back a little bit before Sophie. So, yeah, the passport arrived a couple of days after I'd left. So
it was pretty quick too. Yeah. And yeah. Costa, for you, how long out of Canada should people expect to come?
Well, Sam, this was pre-COVID for me, so I just got to make that clear. We chose to stay a bit longer, and we could have left within 7 days.
Right. So it can be very quick if you want.
Very.
Okay, and you got the Canadian passport quite quickly, don't you?
Yeah. One thing to watch out for. I didn't, because there's a city called Sydney in Canada.
That's what there is. Yeah.
Yeah, and I wrote Sydney, New South Wales, and didn't write Australia. So the government requested that I just fix up the document and write Australia in it, and that delayed us by a few days. That's all. That was the big problem.
Okay, good point. And then you got the Australian documents when you came home back to Australia, did you?
Yeah, within 9 days. It was so easy because, I mean, and even my leave from work and all that was really easy because the altruism in the contracts for the Department of Education, who I worked for at the time, and all that sort of stuff, passport office, everything there was no problem.
Yeah. Lila, can I ask you how your family and friends reacted to you using surrogacy overseas? Were they accepting?
You know, they thought it was very unusual that we were choosing Ukraine.
Yeah.
But they were very supportive of us using a surrogate.
Yeah.
You know, we've been very upfront and honest with everybody and anybody who asks. but yeah, it was a very interesting process.
Yeah. Julian, what about for you? Did you get much support from family and friends at home for the decisions?
Yeah, we're fairly private. I don't think a lot of people even knew that we were going down this path, but
oh, he's frozen on us. Where's he gone? Until then suddenly Julian was on television, so it was quiet for very long. But he seems to have frozen on us. Costa, while we're waiting for him to unfreeze, what about you guys? Was it something you told people very early on that you were doing surrogacy?
So yes, it was. We were very open and forthright about it, and it's something we learnt very quickly from your conference, that kids want to know the truth. They want an environment where they've been told, and so we learned very quickly to kind of create that before the birth.
Yeah, great. Sorry, Julian, you cut out on us before. I was asking you about whether family and friends were supportive.
Oh, very. Yeah, I'm not sure how much you heard, but yeah, very, very supportive. We were very quiet about the process at the beginning, and that deliberately, but obviously because everything was so public by the end of it, it was amazing, the support, and it's still coming in today. Sophie did an interview in France, and she's had over 1 million people view that. And, 99% of people just send these lovely messages and support. There's always the naysayers, but it's pretty overwhelming, actually. It's been...
Yeah, that's lovely. Lika, you're a Georgian national, I think, but living in the USA. Can you give us some insight into what the Georgian public thinks about surrogacy? Is it accepted in Georgia as something a woman can do, or is it not talked about much?
Right now it's more common already. Maybe 5-6 years ago it was not common, but right now is, I think, a lot of parents have like issues. They're trying a lot of times IVF, but I think that's why me and my husband decided to do, because after 3 unsuccessful IVF, so you have to do something. So for me and for my husband, he's Georgian too, but he doesn't have any problem with this decision. So, and around us, like right now, people, they're already like really appreciate with this. This is big happiness, and it's a big help for this kind of parents, like when you don't have any chance. So this is amazing. This is amazing. For me, it's amazing. That's why I'm already in the second journey. So we're doing second round. I'm not gonna stop.
Yeah, that's great. That's great. Julian, for you guys, why did you need surrogacy in the first place? Was it, had you done IVF already in Australia?
No. So I've got 2 older daughters from a previous marriage. My wife, she's got MRKH.
That's right.
From when she was a teenager, that this was probably going to be the only option. So I had a baptism of fire, I guess. I had to learn. I sat at one of your seminars up here in Brisbane and walked away absolutely dumbfounded. I had no idea that IPs, SMs, I had no idea what any of this was about. So, you learn quickly. And, well, here I am now. I'm Liam's 6 months old today. That's his 6-month birthday. So, mate, it's...
and can I ask Julian how old you are now?
No.
I sort of asked that because...
I turned 45 a couple of days ago, mate.
Okay, so. Much younger than me. I asked because a lot of people ask me, they worry about, what will be like being an older parent? That many people come to surrogacy in their 40s. And they do worry. They think, will I be okay? Will I get too tired? Like, was this an issue for you?
Well, interestingly enough, I'm the oldest of 4. I have a sister who's a year younger than I am, and my parents were in their 20s when they had us. And then we say they had a midlife crisis and had a second round of kids when they were in their 40s. So I don't think that it's unusual to have kids at a later age. And frankly, bottom line, I didn't get my act together soon enough to have kids. Didn't find Jeff until later in life. And, we always imagined having kids as part of a family. So, situation is what it is. And I think there are benefits to being older and having kids. More so, our careers are more established. We have, I can tell you point blank, I had a different set of priorities when I was younger than I am now.
That's true.
And I have a lot more patience, and right now, when my child passes gas, it's like, oh, isn't that adorable? And, he blows out his diaper with poop, and it's like, oh, that's just so cute. Let's give him a bath. And, nothing is devastating or a major issue. And I don't know that I would have been so flippant about the situation, 10, 15 years ago.
Yeah, good point. I'm probably the same.
More of a novelty.
Yeah. Costa, for you guys, how long did you talk about having family before you went ahead with it?
Talking about it for about 5 years, researching seriously for 2.
Yeah, okay.
Yeah, thought about it carefully because we are old.
Yeah, like many of us were. Yeah.
Right, you're kind.
I think I was 44 when we had our kids. Yeah, and I was starting to think I was getting over the hill.
Yeah, Sam, 49.
Okay.
Yeah.
There you go. All right, look, guys, we're sort of out of time, but look, thank you so much for sharing. It's been great. Really, really useful for people who many of them are in the same situation as you guys were a year or 2 ago. So thank you so much for your honesty and sharing in that. I know it'll be really, really useful for people to sort of give some people hope that, this can happen for them, that with the right sort of perseverance, you can make it happen as quickly as you guys did once you started. Yeah. So
absolutely.
Yeah. So
never give up. Never give up. Never.
Yeah.
It will happen. It will happen.
Yeah. All right. Thanks, Costa. Thanks, guys. All right. Thank you all. I'll let you go. We've got 1 or 2 more presos to do, so we'll go onto those now. I'm now going to introduce to you Near Karen from Create IVF and Babies Come True. So Near is, as you've heard already from Costa, Near is sort of the guru of Canadian surrogacy. He's been involved in the sector for many years now. He has a child himself by surrogacy in Canada. He's helped hundreds of intending parents around the world to fulfill their dreams of having a child. He knows much more than I do about the surrogacy system in Canada. And he's going to walk us through a terrific presentation really about what you need to think about when you're engaging in the Canadian altruistic model. For many of you here are dialing in from Australia, so the altruistic model is very familiar to you and quite attractive, I know. So welcome, Near. Thank you so much for joining us. That's great.
Hi, and thank you so much, Sam, for doing this conference. I know it's not easy to change from a conference that was actually live in front of people to the whole web interface. But on the same note, that's how we all can be there. So I'm very excited about it. I'm going to share with you a presentation that will walk through a little bit of the surrogacy in Canada. Surrogacy in Canada is a great option, but there's a lot of things that you need to know if you want to engage with that option in order to have a successful journey. So I'm just going to share my screen, and Sam, if you just can stay there a second to tell me that it's shared and it's all good. Can you see that? Okay, I'm assuming that everybody can see the screen. So surrogacy in Canada. So as Sam mentioned, I'm the founder of Babies Come True, and I am the managing director of Create Fertility Center. Babies Come True has been supporting over 1,000 couples on their surrogacy journey already. We're very excited about that. I am well known with all the Canadian systems, work with all the agencies, all the providers, and understand a lot about it. I've been educating in the last 5-6 years, been educating around the world, people who want to engage with surrogacy. I have a baby who's 10 months old from surrogacy in Canada. And yeah, so surrogacy in Canada, these are the few questions that I'm going to answer during this presentation. But when everybody asks me about Canadian surrogacy, there's always these questions that by far they're asking. And the first one is it legal? What's the wait time? How much does it cost? how do you choose a clinic? How do you understand how the whole clinic part work? The difference between United States and Canada, and do I need to navigate the whole journey by myself in Canada? So we'll start by why Canada? Why do people want to choose in Canada? So really, Canada, it's a very safe destination. It's legal, it's safe. I'm going to get to that in a second. It has access to all type of families. It doesn't matter if you're a single mom, single dad, same-sex couple, married, unmarried, heterosexual couple, everybody's welcome in Canada. The cost is very appealing in Canada. When you compare it to other destinations, the cost is significantly low from other destinations. It's an altruistic journey. It's something that we always say that we're calling ourselves currently COVID-19 friendly, because when COVID entered Canada and there are people who were planning to come to Canada for the birth, there's actually a change of legislation which allows Canadian babies to bring their parents, or actually future parents, into Canada when they're engaging in surrogacy. So we expect that because of that, even in the future, if there's going to be any issues, any emergency time, this stay as a legislation. It's also great for people who live with HIV, because there's no extra cost for sperm wash, which other countries can charge up to $10,000. So surrogacy in Canada is legal, and it's legal on the federal level, meaning that it doesn't matter where you are in the country, the government of Canada is accepting surrogacy and actually accepting international surrogacy as a medical tourism. So each province has their own rules regarding the registration of the birth. So that will change from a province to province, and some of them going to fit you more than the others. Something that is always questions, but just to make everything clear here, agencies in Canada are legal. They can help you with finding a surrogate and manage the surrogate fund trust and expenses and everything. However, they're not allowed to charge for the match. This is the only part that they're not allowed to do. So surrogates in Canada will get reimbursed for their expenses, same as a donor, kind of like more or less the Australian model, with a little bit of twist, because in Canada we do allow a bit more expenses than in Australia, and I think that in Australia also you can't have any agencies or any interference, where in Canada you can. So most people will ask, especially in Australia, they will ask, how long does it take to find a surrogate? So I'm going to talk about the whole journey, because it's not just finding a surrogate, it's the whole part. So normally it will take up to between 18 and 30 months to complete a journey in Canada. What we see as a good average is a 2-year average. So if you are a couple that want to have a baby in a year and 1 month, Canada will probably not be the best option for you. Most of the places will take that time, and that's definitely something that we're reporting. If you already have embryos, because a lot of people in Canada, from Australia, will come with embryos that already are made, it's a very simple process to bring the embryos to Canada, even during COVID, and the process will take you between a year to a year and a half. So what's impacting the wait time? Why do we have such a range of 18 months to 30 months? Really, there's so many things that are impacting. And one of the largest things that Australians or people don't know when they're stepping into it is that there's different methods of how agencies operate that will directly impact the time of finding a surrogate. For example, there is a certain type of agency that will have a pool of profile, meaning that a surrogate will go and she'll be able to see all the profiles that are available, and she will choose who the intended parents that she's interested to get to know. Within that process, you can literally be 1 hour on the site and somebody can choose you. But on the flip side, you can be very, very long time, for example, 3-4 months before any surrogate will see you. And if at that point they don't see you, then the agency will proactively help promoting you to to surrogates. However, it can change. Another type of agency is basically the first in, first out. So meaning that there is a wait list. You'll be number 23 in the wait list, and when your time comes up, you'll be introduced to every single surrogate until she will choose you. So that's basically another option. Another type of agency is matched by profile by interest. These are smaller agencies, but still, you know, large enough that they will basically look at the profile of the surrogate and say, okay, so the surrogate says that she, you know, her husband is super funny, she's a little bit dorky, and she grew up in an army base. So do we have anybody that fits that profile? And that's what they're trying to do. And then there are small agencies that basically kind of operate the same way. So there's very different way of agencies. Now, each agency also have a different marketing methods on how they're finding surrogates. Some are investing a lot and doing a lot of great work in finding. Some are just sitting and waiting for surrogates to call them and say that they would like to be surrogates. So that also will impact the time for sure. Another thing that that will impact the time is basically you. You guys are different type of people, whether it's heterosexual couple, whether it's same-sex couple, whether it's a single woman, that will impact the time. So, for example, we do know that single woman will wait longer than same-sex couple. It's just a reality. Now, it could be that by a fluke, there is a surrogate right there that say, I would like to help only a surrogate woman, but most surrogates will be more comfortable with a gay couple, and some don't care. It doesn't mean that you cannot get matched. It just means that your profile has a huge impact on the wait time. That's why when sometimes you go and ask, how long did you wait? You have so many different answers because it impacts. I'll give another example. If you don't like to appear in a video, you don't feel comfortable, you're kind of more shy, then maybe an agency that presents you on a video to a surrogate will not be the best option because you're just going to wait for a longer time. So cost in Canada. The cost in Canada basically will varies according to your choices as well, because every choice will make a difference. But the overall budget that you need to have a journey in Canada will be between 110 to 155,000 Canadian dollars. I think today it's powered with the Australian dollars, so it's an easy math. If you're looking at the two journey, the guarantee program with 2 live birth, you're looking at overall the whole journey. 2 journeys will be between $170,000 to $200,000, and if you already have embryos, we're looking at between 69,000 to 90,000 Canadian dollars for the whole journey. That includes everything that you'll need in Canada, except your personal expenses. So, what is impacting the cost? An egg donor, if you are using an egg donor, and an egg donor lives closer to the clinic, that will make a big difference. And when I'm saying a big difference, it can be $6,000 to $7,000 difference. So it is significant when you're looking at the Canadian model. If she lives more than 2.5 hours away, then at that point, she'll probably have to come and stay in a hotel or an apartment for the length of the stimulation, which is going to take some time, and it will end up costing more. Another thing that will impact the cost is the program at the clinic. The program at the clinic can change a lot, and you will have to see which program you select. For example, if you like to have, if you choose a program that is not guaranteed, it means that if from whatever reason you choose a surrogate and she fails screening and you have to go through another surrogate, then you're going to have to pay again for screening and for meds. On the same note, you have the guarantee programs that basically are including everything, which I'm going to get to very soon. Another thing that will impact the cost is the agency selection, because each agency have a different cost. They're not the same. It range from 12,000 to 20,000. So that's a different. However, it doesn't mean that an agency that charges 20,000 is going to end up costing more at the end of the road, because there's other factors to consider. And then the surrogate location as well. Although the surrogate location is not a huge deal, because normally it's just a travel for a day for the transfer, it's still something that you want to take in consideration if they're far away, and it will impact somewhat. Another one is if you have a stay-at-home mom versus employed versus self-employed, that will impact the cost because we are in a model of reimbursing. And when you have reimbursing, it means that they will get reimbursed for their expenses. So if she's she's stay-at-home mom, it's probably gonna end up costing more or less. It depends. If you have young kids, there's a lot to take in consideration there, but that will impact. Another one is the province where the baby is born, whether you need a court order or not according to the province. So as Australians, you don't need a court order. It's enough to have the birth registration and the easy process that we have. However, the easy process is not in every province. So if you will have a surrogate that is from a province that need a court order, it will impact the cost. And then some of the question that it's important to know is whether rematch is included or not. For example, if you have done one attempt and there's something that went wrong and we decided that we need to change the surrogate, whether that will be included or not. Or if you just, you met the surrogate, you decided that something happened, you decided not to move forward, or she decided not to move forward. Another thing that definitely will impact is bed rest and reduced cost. Bed rest and reduced cost, no matter what in Canada, will always be on top of all the expenses. So it's something that you want to take in consideration when looking for a surrogate, understanding what will be the cost. Okay, so a little bit about CREATE. CREATE Fertility Center is the largest clinic in Canada. It's located in the center of Toronto, and it has been open since '91. And we're looking at over 10,000 babies, including my own, that were created with CREATE's help. And CREATE is a great facility. When we're saying the largest is really the largest by far. CREATE is handling over 85% of the surrogacy cases in Canada, which have a direct impact on wait time as well. So currently we have around 800 couples in the process of egg donation and surrogacy at the clinic. We offer guarantee programs that are 1 live, 2 live birth, and a special program that we came out not long ago designated for same-sex couple, which guarantees 1 live birth for each biological father. Well, we're also the only clinic in Canada right now that can start the journey, and I'm going to get to that in a second. So what is a guarantee program? There was a session not long ago here with families, with a growing family, that were talking about a guarantee insurance. Our clinic has been offering a guarantee program since 2015, and the guarantee program obviously cannot actually guarantee a baby because it's medical, and in some cases it can happen that that it's not going to work. However, the guarantee program at the clinic will offer you a full refund in case you don't get a baby. I will happy to say that since 2015, we had this program for 5 years. We never had to give the money back because we were always living up to the expectation, which we're very, very fortunate and happy to do that. So really, the cost in Canada that I presented earlier, not showing the low cost, not showing the beginners, and then you have to, if you want the guarantee, you actually have to pay more. The range of the cost actually includes the 1+1 guarantee package, which is our most special package when it comes to the guarantee programs. So COVID-19 and the impact in Canada. Obviously, everybody are touching, so I'm going to be very quick in that. I don't want to take too much time. Obviously, everybody knows that there was a lot of impact about it. So Canada has changed the regulation, and any parents who via surrogacy in Canada are allowed to get into the country. So basically, any parent for a Canadian baby or future Canadian baby will be able to get into Canada. While you're able to get in Canada, you will be needing to get a request and approved to get upfront. We never had anybody decline. However, it's important to to do that before the birth, to make sure that you get everything up front. And as far as I know, you also need to get that request to leave Australia during this time as well. During the pandemic, Canadian passport is issued within 3 hours. So everything is very, very fast in order that you'll be able to get back home. But when I'm saying 3 hours, it's not 3 hours from the birth. It's 3 hours from getting the birth certificate, which normally will take between a week to 2 weeks. When you're arriving in Canada today, you can do COVID tests to avoid long quarantine. It's already operating into airports that you can do that. And so you don't have, if everything goes well, you don't have to stay for 14 days quarantine. However, if you're planning to get to the clinic or to a hospital, you're still going to require to do that, and that's for safety measures. Most hospitals in Canada will allow intended parents to enter the hospital for the birth. Some will basically allow only one of the intended parents to be present at the birth. And in Canada, one of the great things that you can do, and this is really only Create, you can start the journey today. Create is basically the only clinic today that have a solution to send the sperm into Canada. Because Canada changed the regulations in February, where it's really just when the pandemic has started, Canada still don't have approved labs or clinics worldwide that are approved by Health Canada to deposit sperm. So we developed a kit that it's basically deposit the sperm at home. We will send the kit to you. You'll deposit the sperm. You freeze it with instruction in the clinic, exactly the same that's been done in the clinic. You'll send the kit back to us. It's very, very simple. We have done that quite a few times already from Australia and other places in the world. In fact, we have done it over 70 times already, and it's great, no issues. We were able to create embryos. There's absolutely no impact on the quality or anything. I know that sometimes thinking about depositing at home is kind of stressful, but also it's much nicer than being at the clinic and depositing it there. For people who really want and insist, you do have an option to come to Canada and deposit the sperm. However, we can get you the approval, but you will need to stay 14 days of quarantine. You will need approval to leave Australia as well, and you'll have to have immigration lawyer involved. So that means that it's actually going to be pretty expensive. So again, the easiest solution and the fast solution will do to use the sperm at home kit. So in Canada, some people are asking if the process is complicated. I will say that the process is not complicated if you know how to navigate the process. So in Canada, you need egg donation agency, surrogacy agency, a clinic, a lawyer, insurance company, and these are all your choices. We're proud to tell you, you choose your team. However, if you don't know how to choose your team, then it becomes more complicated. If you just go on Facebook and ask, what team did you choose? And just try to follow that, as you can see, it makes a difference because every intended parent is different. So it's really important to know before you choose. So Babies Come True is partnered with Create, and we have 14 employees worldwide that will help you navigate the process. We help every single international case of Create will be managed by us, and that's something that Create has found very helpful, and it's basically it's a service that provides for every single of Create's international parents. We will help you with all the medical follow-ups and make sure that everything is done and really manage everything relates to the clinic, not the whole journey. We'll assist you with different languages, the clinic, provide you with overall of the whole process. We'll talk to you about financial consultation, and we connect you with providers and help you with the arrangement and logistic that are related to the clinic. Babies Come True also offer an extended services. And basically the extended services is to be your go-to personal surrogacy advisor and really help you project manage the whole journey. We will issue and we'll create some sort of private lessons to you, meaning that we will educate you for every step of your journey. We will sit with you for a few hours, explain you about that step, and provide you with the knowledge so you'll be able to choose your own providers. So we will help you review agency agreements so you understand the difference between them. We'll help you understand how to choose an egg donor and how a profile looks like and what's the difference between all the agencies, whether one can get a refund, the other one not, and really prepare you for that step. So instead of you going and asking around on Facebook or asking some intended parents, how did they go about the journey, and try to follow their step, really learn about it so you will make the right decision. That's our job, is to educate you. So we'll be constant communication with you. We'll assist you with translation if you need, although Australian don't need translation. Australian need modification from Australian to Canadian. Very different mindset. And if you want to be successful, it's important to enter the Canadian system and understand the Canadian system and also the Canadian culture to have best results. So that's something that is really important. We also, once you go and get your baby, depending on where you are, we have also apartments that we can offer that you can use them, that they have everything that you need for newborn. So you don't have to worry about a stroller or how to bathe the baby, and all these things are just going to be available for you. So we know that in average, babies come true intended parents will match faster with surrogates. And the reason why is because we'll help you shine. Okay, so that is something that we'll help you create your profile so you will shine than others. I have 2 more slides, and very quickly, just to tell you that there's major differences between the United States and Canada, because people always ask what's the difference. The biggest difference is this is an altruistic model that doesn't have monetary compensation. The clinics in Canada are not allowed to have their own donors. So we don't have what they call our own donor program. Our job as a clinic is to screen the donor for you, is to represent the intended parents, and to avoid conflicts of interest where we have a donor that we really like and we try to tell you, use that donor. We're not allowed to do it. You will choose your donor and we'll screen that for you. It's forbidden to advertise for a surrogate and offer them compensation. Gender selection is not something that is possible in Canada unless it's for medical reasons. And we also promised a full refund for guarantee programs, and that doesn't exist in the States. So very quickly, just tip to navigate in Canada. If you're already deciding to go and have a journey in Canada, learn about the Canadian surrogacy. Don't come because of the price. Don't come because it's cost more. Come because you like the model, that you understand the model. Do not undervalue professional help in Canada. You think you can do it by yourself, but the bottom line is that it's much easier when you have somebody who knows how to do it, that helps you and guide you the process. Don't seek for things just in Facebook, and also prepare for bumps. Most journeys, and Sam will be the first person that will tell you that most journeys are not easy, no matter where you go. I know that here we presented great journeys, but most of these are not. Prepare for that and understand that. Also understand that Canadian language is not Australian language. And then higher agency fees doesn't mean higher overall costs. One thing that is very important, the larger the clinic, the faster the match you're gonna get. And the reason is because a surrogate fill-up application, one of the things they're gonna ask her, can you share 1 or 2 clinics that you're willing to work with? If she's gonna write Create Fertility Center, which 85% of the cases are done there, then they'll introduce her only to cases of Create. So if you're choosing a small clinic that is not very known and the surrogate doesn't put it in the profile, you might wait much longer than other places. So just to tell you, I'm the CEO of Babies Come True and the managing director of Create. Andre is our Pacific case coordinator, and we'll be happy to speak to you. We also, once in a while, do a much longer. I wish I could do it, here and speak for 2.5 hours to really tell you everything you need to know about surrogacy in Canada, so you will choose if it's right for you. Stay tuned. We'll be happy to, and we'll provide you with information when is the next information session about Canada is.
That's great. Thanks, Nir. Just a few questions to come in. One of them, can someone import embryos into Canada if they use an anonymous egg donor?
Yes, absolutely. There's absolutely no problem on if the embryos have been created. It's absolutely no problem, and we don't need the FDA approval or Health Canada approval if the embryos have been created.
Yeah, and I saw there were some significant cost savings if people had embryos already. That was great to see.
Absolutely.
Another question that's come in is, what's the go with the 1+1 programs in Canada? What do they mean, 1+1 program?
So 1+1 means that it's designed for same-sex couple, which is guaranteed one live birth for each biological father. Meaning, if both intended parents would like to be the biological parents, this program will guarantee that, financially guarantee that. So if most same-sex couple wants, especially in Australia, wants at least 2 babies, if not more, and they would like to have one of each. Even the 2 live birth guarantee program can design for that, but it doesn't guarantee it. So if you would like to have that guarantee, then 1+1 is definitely the option for same-sex couple.
But it's only guaranteeing enough embryos for 2 babies, isn't it? Not the surrogate costs.
No, it's always the guarantee program is something that you can never engage a surrogate cost, because surrogate get her expenses reimbursed. Meaning, if something happened, you're not going to ask her, well, you spend all this money with something that related to the pregnancy, and now you're going to give it back. This is not how it works. So it's only the clinic, but the clinic is the most significant part financially. If you need to do another egg donation, another cycle, it's going to cost a lot of money. So it's the most significant part.
That's great. Another question that's come in is, what kind of screening do surrogates go through in Canada?
So the surrogate will go through screening, medical screening at the clinic of her choice. Meaning, she will go, when a surrogate applies, she will fill up all of her information, send her records, and the clinic will review it. But once you select that surrogate, then she will need to come to the clinic or go through an in-depth screening, both mentally, so psychological screening, and physically, and then only after that she will get the approval to move forward with you.
Okay. Can a heterosexual couple do a 1+1 program if they're straight couple?
A 1+1 program for what? They don't need 2 sperms.
Good point.
So if we don't discriminate. If you want to pay more and have that, no problem, we'll agree to it. But I would advise that the 2 live birth guarantee program for a heterosexual couple is definitely enough. I mean, the cost difference, just for you to know, Sam, the cost difference is $4,000, very low to guarantee 2 live birth 1 live birth for each biological father.
Yeah, all right. So that's great. Nia, thank you so much. It's a great presentation. I always love hearing it. It's a really, really good one. So as Nia said, there's a Pacific coordinator here in our region for Canadians, Andre Ling.
Yeah, there is Andre Ling. There's actually another one coming in, because Australia is our biggest clientele, Australia and some other countries in the world, but Australia is definitely there. So there's another one coming in soon as well. But Andre is great. He's himself went through a surrogacy journey in Canada. He's from Melbourne. He currently kind of escaped COVID and is in Singapore right now. But he's originally from Melbourne.
Great. Thank you so much, Nia. That's great. We're going to turn to our surrogate videos now from CFC. So that's great. Thank you so much.
Perfect. Thank you so much, Sam. And guys, if you want, we will have more information, because there's a lot to talk about surrogacy in Canada. Terrific. Thank you, Sam, so much.
That's wonderful. That's really great. So just for people who wanted to hear more about the surrogacy in Colombia presentation, we now have, which was cut off early because of time limitations, we have loaded that surrogacy in Colombia presentation on our website in the conference program. We're now going to spend the last 15 minutes just hearing from some surrogates from around the world, and our partners in Canada, in Ukraine, in Georgia have asked some of their surrogates to tell us what motivates them to carry for foreign couples, to give you some insights into that for you. They pre-recorded these interviews. They're quite nice and short, but they should give you a bit of insight. So let's just see how we, just a second. I'm just going to share with you the first video in a minute. Wait a minute. Okay. This is the Canadian one.
I am a surrogate because I wanted my kids to not only talk about doing selfless things, but to actually physically be a part of it. I also have the ability to carry, so I figured it was more of a question of why not. And I really couldn't imagine my life without my own children.
I'm a a surrogate because I wanted to help people grow their family and have children of their own and experience that unconditional love between a parent and a child.
Je suis mère porteuse parce qu'il y a 10 ans, j'ai vu une vidéo d'accouchement où on voyait 2 papas pleurer de joie à la naissance de leur bébé. Je me suis dit qu'un jour, j'allais être cette femme qui allait offrir ce cadeau et me voilà aujourd'hui en train de ce rêve.
I became a surrogate because I see the joy that I have in having my son, and I don't see why sexuality or human genetics should be a reason why you can't have that same joy.
I became a surrogate to help create families for people that need it, and there is enough heartbreak in this world.
I chose to be a surrogate because I wanted to give a same-sex couple the opportunity of having a family. I wanted them to be able to experience all the ups and downs it is of parenthood. I continue to be a surrogate because watching these men see their baby for the very first time is absolutely everything. I've never seen so much happiness in one moment.
I'm a surrogate because I wanted to give somebody else the opportunity to experience the moments that I cherish as a mother. Christmas morning, birthdays, and even the bedtime meltdowns.
J'ai décidé de porter pour un autre couple parce que j'avais de la difficulté à faire le deuil de cette expérience-là magique qui est de porter la vie. Et en même temps, il y a un besoin de gens qui ne sont pas capables de porter leur propre enfant. Donc, c'est une situation gagnante-gagnante.
So that video was kindly prepared by Canadian Fertility Consulting, who are the largest provider of surrogacy in Canada, particularly for foreign couples. So thanks to that team for doing that one. We're now going to turn to the Georgian surrogate experience. We've had the Reparate IVF Tours team have put together an interview with a Georgian surrogate to understand their experience. So let me just share that screen with you as well, if I can. Let's see. Okay, go.
მადლობა დავთანხმდი ინტერვიუზე. რამდენიმე კითხვა დაგისვამთ, თუ შეიძლება, შენი გამოცდილება. გადმოცანი, სახელი გვარი ასაკი, დაოჯახებული ხარ თუ არა და შვილები თუ ყავს მათი ასაკიც.
მე ვარ ნათია ჩიტიშვილი, ვარ 26 წლის, მყავს 3 წლის გოგონა, ვარ დაოჯახებული, ვცხოვრობ მეუღლესთან ერთად თბილისში.
რატომ გადაწყვეტე გამხდარი ყავის სურგატილება?
ეს გადაწყვეტილება მე ჩემ მეუღლემ მივიღეთ ერთობლივად, რადგან მქონდა სურვილი სადღაც ყავით საცხოვრებლად და ამიტომ გადავწყვიტეთ გამხდარი ყავის სურგატილება.
რამდენად მარტივი იყო ამ გადაწყვეტილების მიღება შენთვის?
ძალიან მარტივი არ იყო, რა თქმა უნდა, 6 თვე დამჭირდა რომ მიმეღო ეს გადაწყვეტილება, მაგრამ იმ ფაქტორმა რომ ხარ მეუშვილო წყვილს, პირიქით, ასე ვთქვათ, მიდიც გამისკენ, რომ გამეკეთებინა ეს.
ხომ არ მქონდა რაიმე კონკრეტული მოთხოვნები წყვილის ეროვნებასთან ან რაიმე სხვა კრიტერიუმთან დაკავშირებით?
კონკრეტულად არ მქონია მოთხოვნები, მივმართე სააგენტოს, ისინი დამეხმარნენ, რომ შეერჩია ჩემთვის წვრილი და ესენი პირადად მე ასე ვთქვათ მოთხოვნა არ მქონია.
დაახლოებით რა პერიოდი დაგჭირდა გადაწყვეტილების მისაღებად?
დაახლოებით 6 თვე დამჭირდა რომ მიმეღო ეს გადაწყვეტილება.
როგორ მოხდა შენსა და წყვილს შორის შერჩევა?
მივმართე სააგენტოს და მათი შრომულობით მოხდა წყვილის შერჩევა ჩემთვის.
როგორ აისახა ორსულობის პერიოდი შენსა და მშობლების ურთიერთობაზე, პოტენციური მშობლების ურთიერთობაზე?
პირადად მე მართან ურთიერთობა არ მქონია, სააგენტოს შრომულობით მქონდა კომუნიკაცია, რა თქმა უნდა ექიმების და სააგენტოს დახმარებით ისინი იღებდნენ ინფორმაციას ჩემი ვიზიტებთან დაკავშირებით და პროგრამის სრულობასთან.
და რამდენად ხშირად გქონდა უშუალო კონტაქტი წყვილთან?
უშუალო კონტაქტი არ მქონია, სააგენტოს მეშვეობით გქონდა ჩვენ კომუნიკაცია, თუ რაიმე მჭირდებოდა ასე ვთქვათ, მიმართული სააგენტოს და უბრალოდ ისინი ჩამოვიდნენ შობიარების შემდეგ და მხოლოდ მაშინ შევხვდი მათ, თავიდან არ მქონია მეთქვა.
რამდენად მნიშვნელოვანი იყო ორსულობის დროს ჩვენი როგორც სააგენტოს როლი შენთვის და რაიმე წინააღმდეგობებს ხო არ შეხვდი ამ ხნის განმავლობაში ჩვენთან ურთიერთობაში?
ძალიან მნიშვნელოვანი იყო ეს პერიოდი ჩემთვის, რადგან სააგენტო 24/7-ზე იყო ჩემთან კომუნიკაციაში და ძალიან დამეხმარნენ ისინი ამ პერიოდის განმავლობაში და ყოველთვის ხორცი მედგნენ.
და მომიყევი შენი ემოციური მდგომარეობის შესახებ ორსულობის პერიოდში და შემდეგ.
ну სულ ჩემსაღი ემოცია მქონდა, რადგან გააზრებული მქონდა ყველაფერი, რასაც ვაკეთებდი და ამიტომ არანაირი დაკვება არ შემიძლია.
როგორ გააგრძელე ორსულობის შემდეგ?
ძალიან კარგად.
ჩაუდეთ
რეჟიმში კი.
რა რჩევას მისცემდი პოტენციალურ მშობლებს, ვინც ეძებს სუროგატ დედას ახლა?
პირველ რიგში მათ ურჩევდი, რომ აირჩიონ პასუხისმგებლიანი ადამიანი, რადგან როცა სხვის შვილს ატარებ შენი მუსიკა სურმოგი პასუხისმგებლობა და ეს ყველაფერი პირადობაში ასრულოს სუროგატ დედამ.
ძალიან დიდი მადლობა.
So look, you can see that in the Ukraine and Jordan context, the agency will choose a surrogate for you, and you'll have much less contact with your surrogate in that context than you will in Canada, where the language barriers aren't there and where the surrogate in Canada or the USA will expect a lot of contact with you. And I think that's borne out by that video. We're just going to look at one more video for those who are interested, which is really interviews with some Ukraine surrogates prepared by World Centre of Baby. It's a slightly longer one than the other ones. Let me just share that screen with you now as well. Let's see. Okay.
Я зі Сміли, Черкаська область. Маю двоє діток. Я захотіла допомогти людям, які не можуть родити діток, не можуть так само бути щасливі, так як і я щаслива, яких я маю двох замечательних хлопчиків. І вирішила допомогти батькам. На другий раз, друга попитка моя, я вирішила також допомогти батькам, які не можуть мати діток, і зробити в квартирі ремонт. Відносяться вони позитивно, що я допомагаю людям, які не можуть мати діток. Я з ними познайомилася, коли підтвердила, що я вагітна. І мій куратор мене познайомив по скайпу із цими батьками. І дійсно, коли підтвердилась моя вагітність, і я побачила, і їм сообщили нове, що в них буде двоє діток, і я побачила їхнє лице, які вони щасливі. Я за кожним візитом до клініки я завжди общалася із батьками по скайпу. А тоді, звичайно, так сказати, день вони мене знайшли у Фейсбуці, і ми почали самі общатися. Вони кожен день до мене дзвонили, питали, як я себе чувствую, що мені хочеться. І я дійсно побачила, що вони хочуть цих діток, які вони будуть раді, коли ці дітки являться на світ. Я побачила їхню любов до цих діток, а також і до себе. Вони за мене дуже переживали, як мені там було, чи важко було, чи не важко. Кожен раз вони мені писали, як ти себе чувствуєш, чи тобі важко, чи не важко, що ти сьогодні їла. Пройшли вони супер. Те, що я так далеко від дому, і мене зараз підтримує все моє агентство, і я начебто в окруженні своєї нової сім'ї. Да. Внімательні. Кожен доктор, кожна медсестра до тебе має свій такий підхід, що ти наче попадаєш в рай. Мені посовітувало ваше агентство моя знайома, яка вже пройшла половину етапу, і вона посовітувала мені іменно це агентство. І я согласилася. Дійсно, її, те, що вона мені говорила про агентство, і дійсно воно підтвердилося іменно любов'ю до нас. Що до тебе скільки уваги приділяють. Не було такого.
Тобто не було ситуації?
Ні, не було таких ситуацій, щоб вони мені вказували, що я повинна їсти, де я повинна гуляти. Гуляю на свіжому повітрі, харчуюся нормально. Дуже це рідко буває. Такого немає, що там то хочеться солоденького, то кисленького. Це дуже рідко. Медичний огляд, аналізи. Підтвердилося, що я здорова, що я можу стати сурогатною мамою. І почали мене підготовлювати, щоб стати мамою.
От сугубо ваша думка, яка вона є?
Я не думаю, що це експлуатація жінок. В першу чергу мене ніхто не заставляв. А ти сам йдеш на таке, щоб батьки були теж щасливі, бо дійсно батьки не можуть сама жінка не може завагітніти, і вони теж хочуть собі радість. І я не вважаю, що це є експлуатація жінки, коли я хочу подарити комусь теж невеличку радість. Були питання, говорили, що я виношую свою дитину і продаю дитину другим батькам. Ну це дійсно, що неправда, бо вони не знають, як це все происходить, як починається цей етап, що тут мого немає нічого. Тут все йде від батька і від матері майбутньої дитини, яку я зараз носю. Ну їм цього ніяк не розкажуть чи не докажеш. Після народження хлопчика у мене незакінчений в квартирі ремонт, і я планую доробити ремонт, а також я хочу з сім'єю десь поїхати, відпочити.
Okay, really interesting. Thanks, Wilson and Baby, for that video. It was great to hear from Marina. I hope this session's been useful for people. There's a lot of information covered. We'll try and put some of the presentations on our website afterwards, but I know it's a complicated area, so if some of you have more questions, we will send you a link to the recordings of the sessions if you want to play some of them you've missed. And we have a consulting service for parents who want guided support in the area, because we know how nerve-wracking it can be, having been through surrogacy myself, and having helped hundreds of parents over the years. It's something that we love doing, I love doing, but it does require lots of support, and we're here to provide that. So thank you everybody for attending. It's been great to have so many of you here. Any more questions come through? Yep, I think we've answered all the questions that have come in. If you have other questions that weren't answered today, you can just email us as well. All right, thank you so much.